Hello and welcome. My name is Tyler Best, and I am one of the Springboard community managers. Today's webinar, Connecting the Pieces, Fostering One Health Risk Communication Systems and Coordination, is presented by Springboard, an online community under the Breakthrough Action Project. Breakthrough Action is USAID's flagship program on social and behavior change, and ignites collective action and encourages people to adopt healthier behaviors by forging, testing, and scaling up new and hybrid approaches to SBC. If this is your first Springboard webinar, then welcome. So what is Springboard? Springboard is an online community of over 4,000 SBC professionals from over 120 countries. Springboard can help you advance your SBC skills, connect with colleagues and SBC leaders, and get inspired through resources, events, and jobs. If you're not a member already, join today. Today's webinar includes presentations in English and French. Please find our friendly colleagues that can help you in case you need technical assistance. Note, though the presentations will be in the presenter's language, we will send out all presentations following the webinar in English and French with the recordings. We are using simultaneous interpretation for today's webinar. To enable this, click on the interpretation icon at the bottom right of your screen and select language. By selecting this, you'll be able to hear the translation. If you're using a phone application, click Meeting Controls, select the three dots, and then select the language you want to hear. We'll be starting today's event with 3 presentations, followed by time for questions and answers at the end. Feel free to use the chat feature on the bottom to introduce yourself and your organization. You may use this feature to ask any questions for the speaker throughout the event. We'll compile those to use during the Q&A session. Now, finally, on to the show. Our first speaker is Dr. Catherine Machalaba and comes to us from the EcoHealth Alliance, where she's the principal scientist for health and policy. On to you, Dr. Machalaba.
Thank you. Thank you so much. It's really an honor to be with you all, and I'll keep my video off for now. I'm having some connection troubles, but hopefully you can hear me just fine. I'm thrilled to really introduce the One Health approach and show the value of it. And I see it as something that's not really new, but something that is really a tool to help us add to our existing really positive impact. So with that, if we can go to the next slide. The definition of One Health. So I want to just stress here, it's an approach. It's not a new discipline. It's not a new silo, but it's an approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. And it recognizes the interconnectedness and interdependence of the health of humans, domestic and wild animals, plants, and the wider environment. And just to stress here that it mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together on outcomes related to many different things, including reducing the burden of infectious disease, but also contributing to safe and nutritious food, taking action on climate change and sustainable development overall. And this was the definition that was adopted by the 4 UN agencies, including the World Health Organization in December, and it really seeks to be very comprehensive and inclusive. And if we go to the next slide, we can just see visually that we're looking at sectors and disciplines, we're looking at society, and bringing together communication, collaboration, coordination, and capacity strengthening across sectors, across society, many different stakeholders to contribute to these outcomes of healthy ecosystems, healthy animals, and ultimately healthy humans. And if we go to the next slide here, we can see really the need for a One Health approach. We know that many infectious diseases, in fact, the majority of human infectious pathogens are zoonotic. So they're shared with animals. This is not a one-way road. Actually, humans can also transmit pathogens to other species, but we see that the frequency, magnitude, and impacts of epidemics are increasing. So we really need to be thinking about a One Health approach, working together to understand these connections. And this really gives us the opportunity to better prevent, detect, respond, and recover. And if we look at this slide here, we see that typically when there's an epidemic in humans, we respond really late stage, once it's recognized, once there's spread, but we can actually work upstream to share information earlier on detect things earlier on, ideally before emergencies occur, or really rapidly to respond very effectively and recover very quickly. And if we go to the next slide, when we think about health security, we often hear prevent, detect, respond, and recover. And we often think about these in very different ways. It's often different communities or sectors working on each piece here. But we see also that while there are specific functions that do fall under prevention and then others that are really specific to response or recovery, some are cross-cutting, such as governance, regulations, community engagement, and resilience. And we really need to be thinking about this in terms of working across all of these different spectrums of health security. So making sure that we're building systems to be resilient, to be really prepared, whether it's at the prevention stage or all the way after when we get to recovery. And if we get to the next slide, when we think about a One Health approach, it's not everyone working together. So it's improving collaboration, making it more routine, but the context really matters, and it will look quite different depending on what the objective is, which disease we're working in, which community we're working in. We really need strong human, animal, and environmental health systems to be able to determine who the relevant stakeholders are and work toward solutions. And I think when we think about these three sectors, human, animal, and environmental health, and how they can work together, we need to identify the entry points for where it's really cost effective for each sector to work together, what their role can be, and helping to really prevent but also recover from the many impacts of pandemics, of epidemics, of endemic diseases. And that's really where a One Health approach can be very beneficial. If we go to the next slide, we can see that there are some key areas of focus, especially for when we're thinking about working with communities and then also the stakeholders at subnational level and national level and all the way to global level. So the four key areas that I typically think of are managing risk and burden. So when we're working in communities, we can really get a sense of the day-to-day animal and environmental exposures that may present disease risk. And we can look at the vulnerabilities, look at what's changing those factors, what may be protective, and then the response and risk communication. This is typically where we see a big challenge with consistent messaging to understand disease risks, and really, especially when there's an animal component, that's very important to have that collaboration and communication with the animal health sector and relevant authorities. And then community engagement. So taking action for safer practices in our daily lives, really advocating for disease risk reduction. So empowerment about practical strategies that can be taken in the relevant context that a community or individual is living in. And then lastly, coordination structures. So making coordination routine, whether it's at government level, whether it's at community level, to really be able to be very agile and bring in different sectors as relevant to better identify and manage disease risks. So I'll just show some quick examples of each of these. If we go to the next slide, when we think about early warning systems, this is sometimes really seen as all the way at the prevention and detection, but it can also help us to prepare to respond more effectively, to really be ready. And we can see here, this is some great work from our colleagues at NASA. So from satellite data, looking at weather and climate trends actually 6 months ahead. So we can really get a sense of what's likely to be happening. We can see that in some areas, risk of mosquito-borne diseases will increase. And we can imagine how people may move because of these changes, whether it's drought, whether it's heavy rainfall, and the exposures that they might have. And typically when people move, they may move with their animals. So we can think about vaccination campaigns, for example, for Rift Valley fever. So the value of this information to really be ready and prepare and make sure that societies are resilient. So I think this information, not only collecting it, but making sure it gets to those who need it and can use it in a timely fashion is really where a One Health approach can help. If we go to the next slide, just to show an example of this great tool, Living Safely with Bats, and there have been different adaptations of this, including with the Breakthrough Action Team. I have seen it in use in communities, and it's really a wonderful tool to get out to talk with people, to make sure that people recognize how important bats are for ecosystems. So we know bats can transmit diseases to humans that we should be concerned about, but we can't go and kill the bats because they're very important for our ecosystems, for food security, for insect control. So really giving practical ways of managing risk while also respecting the environment. If we go to the next slide, we see that response and risk communication, this is where, if we don't have a One Health approach, we can really miss out. So the example on the slide here where we see when there's a single sector approach, the information doesn't flow between different sectors effectively. But when we bring a One Health approach, we connect the dots more rapidly, we understand the situation, we understand the sources of risk, and we can manage the risks as well as the impact. So it's really being empowered to have information flow together in a more timely fashion and give us the full information needed to understand the situation. And if we just go to the last slide here, just to show about coordination structures, and many countries are taking on board One Health coordination platforms. And these are very exciting. Sometimes they have the support of central government, sometimes the vice president or prime minister even presides over the coordination structure. And it's a way to meet more routinely, to really find specific disease objectives to be working toward, and to start mobilizing resources in a way that can really respond to the need across sectors. So this is an example from Liberia. It's really exciting to see these structures grow and to really have impact on the ground. And I think there's a lot more opportunities to upscale these, and we'll hear more from our other speakers about this. But I'll just refer you to the World Bank One Health operational framework. This came out in 2018, and it really has quite a lot of information and is a great tool if you're looking to learn more about One Health. But just to say thank you so much for the opportunity, and looking forward to our next speakers. Thanks.
Thank you, Catherine, for that excellent overview of the One Health platform and approach. I can see in the chat already, people are very keen for your slides and for all your resources. So thank you again. On to our next speaker. Our second speaker is Dr. Olayinka Umar Farooq. Dr. Umar Farooq is the Deputy Project Director for Risk Communication at Breakthrough Action Nigeria. Over to you, Olayinka.
Thanks so much, Tyler, and great presentation, Catherine, and setting the stage for the discussion. As Catherine mentioned, it's really One Health is not new, but it's really bringing about people together and addressing the health, animal, and ecosystem in which we all live in. Next slide, please. So I'll be talking around these three key areas, around the background, the approach, the challenges and recommendation, and looking at what's happening in Nigeria. It's really a struggle. I view One Health as a kind of like marriage where people need to come together to understand each other, and knowing that everybody is coming with preformed ideas or information on how you've always lived your life. But now we all need to kind of like come together to work together for a common good. So it's kind of like a new, yes, it might not be a new concept, but it's kind of like a new approach that's going to take a while for everyone to buy into. But we are gradually taking baby steps, and I'm going to share how we are moving forward with this. Next slide, please. So I'll go into our background. This picture is just showing one of our approaches, which is called the community drama, making sure that communities are able to take ownership of activities they do, but a little bit background on the One Health approach in Nigeria. So Nigeria is one of the most populous country in Africa with over 240 million people. We have an annual growth rate of about 2.6%. And we continue to see an increasing burden of infectious disease and non-communicable disease. Currently, we are battling Lassa fever outbreak. There's polio, also outbreak ongoing, monkeypox in some locations. We still have the COVID pandemic. And as Ketri mentioned, the context does really differ. With 36 states and the FCT, it's really a different context for each state. So one of the key things is the One Health approach is definitely something that we need to focus on, and the fact that risk communication can actually help stem outbreak response by influencing either personal or social behavior change that aids transmission. So I'm going to share some our approach to how we're currently supporting the government of Nigeria for this. Next, please. So Nigeria is a signatory to, is one of the member states for the International Health Regulation, and we report annually around disease surveillance under the Assess, Detect, Respond, and Report. In 2017, Nigeria had a joint external evaluation, and the different scores were provided. By 2019, we did a midterm review and also the national bridging workshop, where the different sectors or different players within the One Health sector sat down together to look at, okay, what exactly are we doing and where were the missing links? One of the key things that came out from that particular bridging workshop was the issue around coordination, communication, and collaboration as key areas that the country needed to focus on to strengthen the One Health approach or concept. And at the end of that meeting, one of the key things that was launched was the One Health strategic plan. The plan was really, it's a 5-year plan between 2019 and 2023 that focuses on a shared commitment to enhance multi-sectoral collaboration in addressing human-animal ecosystem public health challenges. So we had that blueprint on ground, but as we all know, COVID came, and it was a bit challenging to begin implementation of that particular plan, but the country has made progress. Next, please. So the plan has 5 key goals. I'm going to focus on goal 2, goal 3, and goal 5, but touch a bit around goal 1, which sets the foundation of how One Health approach is being implemented in Nigeria. Next, please. So our goal really for breakthrough action and supporting the One Health is looking at strengthening coordination, communication, and collaboration. Next, please. And hinging it on capacity building. So goal 1 is sustainable and institutionalized One Health platform at all government levels. This flow chart is what's inside the One Health strategy, and this is how the foundation for One Health in Nigeria is being visualized and implemented. Unfortunately, it sits just at the national level. The thinking around state level has not materialized in the strategic plan. But even at that, if you look at the key thing is the National One Health Coordination Unit, yes, that particular unit is working effectively and has representation from the human health, animal health, and environmental health that sits together to start driving the vision around One Health. So that's regularly happening. Another key thing that is happening in terms of having to institutionalize is a technical working group, then having disease-specific technical working group, making sure that technical leads from the different One Health key sectors. So in terms of institutionalization, the country has a framework, but it's a framework that is currently limited at national level and focusing more around having that initial, the key sectors working together in the first instance before moving a vision down to subnational. Next. Goal 3 is breakthrough action Nigeria's key focal areas, which is really increasing awareness of One Health for all stakeholders. And it has 3 key buckets. One is on improving public perception and awareness on zoonotic diseases and the One Health approach. So in 2017, Nigeria prioritized 12 diseases as the priority zoonotic disease in the country. Ways that we supported the organization is social media engagement strategy that helps to communicate effectively with the general population around these diseases. We've supported also focusing on 2 out of the priority diseases. We are focusing on Lassa fever and yellow fever. We have been producing and doing mass media across targeted states in the country to create more awareness on these zoonotic diseases and supported commemoration of different World Days. For capacity building, it's been a key focal area for Breakthrough Action Nigeria. And we started with doing a stakeholders mapping to identify where are the critical stakeholders in this sector, and then doing a capacity needs assessment. We've adapted the Johns Hopkins University One Health Risk Communication Training Package and worked collaboratively with the key government stakeholders that drive the One Health concept. That's the One Health Coordination Unit as master trainers. So they took ownership, adapted this training package, and we were able to build capacity of 33 people across the public health sector and the media to understand One Health risk communication better. Across the country, there's a new drive for joint risk assessment, working collaboratively with the key sectors, health, environment, and animal. And this has been done both at national and subnational level. The third key bucket is on standardizing a communication plan. And the country is currently working on a multi-hazard risk communication guideline that helps to look at the different hazards and not just health, also with the mindset of the One Health approach. We've also supported the country to look at the prioritized diseases. We had done on rabies, that's why we limited it to 10, and have a specific communication plan. What do we want to say about these particular diseases? Who is the target audience? And we're taking steps to develop different communication materials for this. In terms of the One Health and putting everybody under one umbrella, a new group called the National One Health Risk Surveillance and Information Sharing Group has been inaugurated at national level. And the whole purpose is to look at how do we share surveillance information more frequently and in a way that we can quickly respond to outbreaks. Next. So for Goal 5, that's on effective prevention, detection, and response to public health threats through the One Health approach. Breakthrough Action has narrowed down to a particular state in the northeast of Nigeria called Bauchi. And this is a timeline of some of the activities we've done using the lens of the One Health. So having that entry meeting with the One Health stakeholders at subnational level in one place, putting everybody together, then focusing at the district level, who are the people there that needs to be engaged. So the disease surveillance and notification officers, with the health promotion officers and the area veterinary officers and the environmental health officers, and having everybody at that level to come together to sit in one place, then collaboratively developing materials that will be used to focus on moving the response. How can we move a response from, how can we move Lassa fever from a response mode to more of a preparedness mode, so more of proactive. So we wanted to do community level activities that kind of like promote understanding or signs and symptoms of these diseases and promote early reporting for some of them. So those are some of the activities we've done. Next. And these are some of our results. So in terms of trying to move to more proactive, we've been able to reach about 16,000 people with messages. We've been able to actively detect cases. One of the key things that we've also seen is how one of our interventions called community drama led to more cases being confirmed cases. So in that particular community, what was being reported is suspected cases. And by the time we went in and did like a community drama for the community members to understand the signs and symptoms, we now started seeing confirmed cases, and it helped the state to be able to manage the cases better rather than from suspected to actually confirmed, and then these people are able to get treated. Next, please. Then challenges and recommendations for moving forward. At the national level, there's still suboptimal coordination and collaboration amongst the tripartite sectors. So it's when we look at the stakeholders mapping and try to see who is where, we see that the health sector has more partner support and just really wondering what's happening to the other sectors. So there's a need to continue to strengthen collaboration at the national level. There's also challenges with information sharing. And one of the things recommendation is around modeling through joint rapid response deployment. So if there is an outbreak that is health related, to what extent can you involve the other sectors and do a joint response? And with that, it shows transparency, and then everybody, we're able to coordinate better. Overall, there is inadequate human resource to implement risk communication activities, and we continue to focus on capacity building, leveraging on the technical working group for risk communication at national level, with a hope that they can also further cascade. Next. At subnational level, Nigeria is large. Our experience from Bauchi shows that, yes, we can start small and then grow gradually. So prioritizing states to see where do you want to start with the One Health approach, knowing that you can't do it all at the same time. And having at the back of our mind the whole of society approach in doing this. Vertical programming and weak coordination continues to be a challenge. Promoting integration, how do we leverage existing resources? So if you have an immunization program that has different already in it, how do we strengthen that particular coordination structure? Overall, poor resource allocation and having a costed state action plan can be a way for effective resource mobilization and utilization. Next. Then generally, really low perception and awareness on zoonotic diseases, continue to use public communication to engage using mass media to talk about PZD's One Health approach. Also making sure that you leverage the media stakeholders as an ally for One Health, and then incorporating the One Health concept into pre-service. So in the medical schools, the veterinary schools, how can we get more people to be aware of One Health concept ahead of more in pre-service, then continue to emphasize around preparedness and prevention rather than response. And I think, thank you very much. That's all for me.
Thank you, Dr. Umar Farooq. And again, it looks like many people are excited to have your slides and your resources. So just as a note, we will be sending out all presentations in both English and French. All right, so our third and final speaker is Fatmata Khan. Fatmata comes to us from Breakthrough Action Guinea, where she is a GHSA program officer. Over to you, Fatmata.
Alors, bonjour à tous. Désolée pour l'interruption de tout à l'heure. Donc, ma présentation va s'articuler autour des activités du projet Breakthrough Action, mais surtout la mise en œuvre.
Project Breakthrough Action and the implementation of our project here in Guinea. And for the presentation, I will be speaking about the context of Guinea. And I want to thank also the speakers that came before me, because they spoke about Nigeria and that helped. We're going to speak about the main achievements, the challenges, the lessons learned, then our perspective and new opportunities. Next, please. In Guinea, as you know, in 2014, we had a crisis crisis of the Ebola disease. And these reinforce the conviction of different actors and partners in the need of a multisectoral intervention. Then, in 2016, we created the PNOH, a project financed by USAID. Then we had a document between Ministry of Health, Environment, and Breathing, and we created this multisectoral group. In 2018, we developed a strategic plan, One Health, and we created this new the creation of this new platform in Guinea. In 2019, we created new different platforms, not only at a regional level, but also at local levels. These platforms were possible thanks to the WHO, the World Bank, but also the organization, the International Organization of Migration. We can continue, please. The Breakthrough Action project started its activities in 2019 thanks to the funding of USAID. We have the GHSA, and we are working on the collaboration and coordination of different partners. Also, the implementation of different communication activities in the priority zones. And our priority zoonoses are yellow fever, dengue, anthrax, rage, Lassa fever, and other diseases like Ebola and the Rift fever. Next, please. The activities in the project are aligned with our national plan at a ministry level. We have also the evaluation we did with the EE in 2017. And the idea is to improve our indicators and the score. As you can see, we have we had 2 indicators that were red, which means we did not have this capacity, and one of them was risk communication and systems for unusual and unexpected events and emergency, and the second, public communication for emergencies. Thanks to Breakthrough Action and other partners like WHO and Project Lycée, we were able to change the score and change it to 2. We were developing multisectoral communication, and we were also implementing good communication techniques. Concerning the public communication for emergencies, we did different activities. For example, communication campaigns, doing an action synergy concerning multisectoral activities in collaboration with different departments of health, environment, and breathing, but also with all our partners that are in this domain, which means, for example, FAO and other projects. Next, please. For Breakthrough Action, what helped working with this platform was our workshop where we could create one synergy, and we could also avoid using our resources. We have also the coordination, not only at the regional level, but at a local level too. As I was saying, we had different actions, synergy of actions for campaigns in anthrax, rage, COVID, and with other partners like GZ. And we were able to coordinate and collaborate with these activities. We did an evaluation of the capacities and needs in risk communication, and we were able to create a communication plan that will be implemented to create a better working technique. There is another activity that's important to understand the different actors in GHSA and to understand who intervenes and where. And as I was saying, we also had a guide that defines the role and the responsibilities of all the actors in risk communication when a risk is present in Guinea. Last year, we created different exchange sessions. Next, please. Next.
Qui ont permis de faire un partage d'expériences sur les meilleures pratiques dans le cadre de la communication de risque, mais aussi pour partager l'expérience de la Guinée dans le cadre de la mise en œuvre du plan stratégique de la plateforme Une seule santé. Donc, il y a eu la révision du plan national de communication multisectorielle l'année dernière que nous avons eu à faire avec la GIZ. Donc, cela dénote vraiment de notre volonté et la bonne collaboration que nous avons avec les partenaires pour la mise en œuvre des activités. De même que le guide de messages harmonisé dont nous avons 2500.
We have also had different messages. Thanks to the collaboration with different projects, Breakthrough Action has created a guide with all the partners and actors. And this project helped with the dissemination at the national level. We have also done a qualitative research concerning this message guide, but we were also able to do it at an operational level. We have also done another couple of activities, and we are very proud of it. We have done some activities at different levels, and we're able to share them throughout the whole country, but also in the regions. Next, please. So concerning the uniqueness of the communication systems, we created a risk communication and a community engagement tool that is managed by the regional agency. And we were able to create a framework to validate all the messages that were used at the prevention level, for example, for different epidemic issues, like, for example, Ebola recently, and we were able to support and elaborate new action plans with this commission. This commission is composed by different departments, but also with different agencies that are involved in risk communication. As with everything, we also are experiencing some challenges. And in Guinea, next please, the challenges are as follows. So they are the functioning of these platforms are very hard to follow. So to be able to solve this issue, we were trying to improve these platforms this year. We created a logistics agency so that we could have more exchange and also more feedback. As another challenge, we also have the lack of monitoring and evaluation of our actions. So what we are planning this year is that when we'll have our technical group reunited to do a monitoring every 3 months of all the activities to make sure that there is an integration and see what are the other actions done and make sure that we are following up with all the activities done. We have also a problem with the coordination at the national level because we have a lack of human resources and resources in general. So we are trying to mobilize the resources with the ministry to make sure that we are coordinating with the different platforms. And during our workshop, many partners decided to support us with this platform. So during our interventions, we had also some lessons learned. Next, please. So we have the partner mapping, and this allowed us to identify the actors and where they were, but also to create intervention zones. And we have a action plan that we are doing every year, thanks to the support of Breakthrough Action Project. And we are trying to concentrate all the resources and efforts. We were able to do it with GEZ, the last one. And we can see that we are collaborating with other partners. We are also, what we also learned is that the capacity reinforcement in the community is very important, especially if the leadership is managed by the same people from the same community. We also try to engage media in the elaboration of our strategies so that the journalists can understand this concept of the One Health, but they can also share all the communication during health crisis. For our perspectives, next please. We want to have a follow-up and a monitoring of our PAOI with our different partners. We want to reinforce the capacity of our working group through our training plan. We have multi-sectoral communication with different ministries, but also with different partners. We want to create different campaigns with different topics. Different topics were identified: rage, flu, avian flu. So we want to do these multi-sectoral campaigns this year with the support of all our partners. We are working, right now we are working on a campaign against rage, and we are collaborating with all our partners. We are also trying to reinforce the control and the surveillance with our partners. The opportunities, we do have many opportunities as well. And today, the coordination challenge we have can be solved, and these will enable us to have more exchange. We have the wheel of the different partners. Most of our partners do have an action plan to reinforce the capacities. We also have technical groups with different partners, financial, economic, and different partners at the ministry level to organize communication campaigns, but also to celebrate, for example, the World Day of One Health. Interpreter is very sorry, but we cannot hear the speaker anymore. So to conclude, our platform One Health, next please, okay, is enabled at the national level, and we are improving and all the efforts are being done, and we will be able to solve the functioning of these platforms, and we will be doing it with our partners that are intervening in this project. And Breakthrough Action Guinea is engaged in collaborating with all the partners and all the ministries so that we have this importance of the multi-sectoral collaboration so that we can improve the communication risk in Guinea. Thank you very much. And if you have questions, I stay here at your disposal. Thank you very much.
Thank you, Fatmata. And since we are running pretty low on time, and I don't know if we want to tempt fate, we may ask the presenters to come back, turn on their cameras if possible, and just share any final thoughts after seeing the presentations, any final thoughts on coordination, or your reactions from today. Over to you. Perhaps we can start with you, Catherine. Go ahead.
Thank you so much. Thanks to everyone for the great presentations and great comments. I just wanted to address the question from Dr. Ashik in my final remarks, just to say that in Bangladesh specifically, there is a One Health Secretariat that is getting started, but there's also a One Health civil society group, and really bringing together different professionals, creating sort of a culture of working together, addressing specific issues like rabies, but there's so much broader scope. And I would say that if you don't feel that the sector or discipline that you're working in is at the table yet, you have so much to bring to the dialogue. And there's always more to do via a One Health approach. And I think our presenters showed the way that drama, theater, arts can come into that, and really add by reaching people in a different way. So I think the sky is the limit, and I would just encourage everyone to bring their unique talents to the One Health approach. Thanks.
Thank you, Dr. Machalaba. Dr. Umar Farooq.
Really nice hearing from everyone, and it's been a great pleasure sharing our experience. And One Health, though not new, is going to require baby steps, and we just need to kind of like open our minds to it. And the more multidisciplinary skills set we can get on it, it really goes beyond the human, animal, and environment, but really multidisciplinary. It's going to be great. It's a struggle across most countries, but we're definitely going to get there, slowly but surely. Thanks.
Thank you, Dr. Umar Farooq. Fatmata, any last thoughts from you?
Oui, alors je dirais que oui, donc je dirais que
Yes.
Aujourd'hui, avec toutes les épidémies qui se
I want to say that today, with all the epidemics that we are seeing in the world, we have to work together, because the human health depends on the animal health, and it depends on everyone. And it depends on everyone that lives with us every day. So we need to make sure that this concept is everywhere. And we have to work all together to use this system when we have an emergency, a health emergency like we did have. We need to have a framework, and if we use it only when there's an emergency, we lose a lot of time. So we need to work together. And the recent epidemics showed the importance of working together. Thank you very much for sharing your information. Thank you very much of this approach. It was a pleasure to share with you my information. Thank you very much. Thank you, Tyler, for your time. Thank you very much.
So first off, thank you to all of the presenters for your excellent work today. It's very clear that everybody wants us to share all of those presentations immediately. So we will be getting these out in both English and French within the next couple of days. Thank you for your patience. We are really, really, truly sorry about all of the technical issues today. but we will be posting the recordings as well. And if you do have any continuous questions or additional questions, please feel free to use that event page on Springboard to ask those, and we'll make sure that they get answered from the right person. So thank you all so much for joining. Thank you to the presenters for your great work, and continue watching out for future Springboard events. So we're going to leave it for now, and have a great rest of your day. Thank you all.